My friend's husband, a 69-year-old male, started to have memory loss for the past 3 years and continues to worsen, specifically with words and conversations. He has a non-operable lesion in the brain and has recently been diagnosed with vascular dementia. He is still able to do his normal daily activities without any problems. Is there any oils or herbs or protocols to reduce or slow down the symptoms and progression?
Vascular. I mean, I would use probably a couple of things. I would probably use rosemary verbena. That could be inhaled or taken internal, or both. And then I would use chamomiles, like Roman chamomile, German chamomile, even blue tansy or dark blue tansy. Yarrow could even work. Those could all just be inhaled, but like 25 inhalations, maybe twice a day. And that could be helpful. Yeah, but I would almost do them both. Like I do the rosemary and then one of the chamomiles or yarrow or something. And the inhalations with the rosemary needs to be done a couple of times a day as well. Yeah.
Now for the internal, what would the internal be?
Like two to three drops in water internally. This is what I'd also say about this is check this person's breath. You know, if it's a short, rapid breathing. I mean, sometimes what happens is the neck can get so tight, especially those two rope muscles that come from behind the ear, and one goes down to the clavicle and one goes to the sternum, so sternocleidomastoid. They pass over the carotid sinus, and if they're really super tight, it does impact blood flow to the head. And so energetically, the throat minor, like the bottom part here, and then the back of your head, both impact the carotid sinus, which would impact circulation to the brain. And so the rosemary and the chamomiles will help like the brain function, but make sure that the breath is deep, the breath is like slow and not like rapid, you know. The more you loosen up the diaphragm and the neck muscles through like using something like hyssop or the bronchioles blend or like Sitka, you know, anything, myrtle, anything that helps to relax the diaphragm will also relax the neck. I also like the idea of putting some of the vetiver across the base of the skull, just because that opens up the nuchal ligament, which opens up this whole plane of fascia around the neck, the head, and into the upper back. And sometimes that will open up circulation as well. And so, you know, you just kind of apply the vetiver all along the base of the skull. And we put it, you know, you can get a 5 mil thing, or you can use the roller ball where you can just like roll it on and hit it that way. And so, I mean, I would go at it with those three things. You know, I would go at it kind of hard, you know, because like, you know, if it's progressing and it's, yeah, you know, there's different kinds of dementia, but I would tackle this pretty aggressively, actually.
Great, thank you so much.
Mm-hmm.